I run an organization called the Financial Health Network. We're the leading authority on financial health, and we're essentially a resource to business leaders, policymakers, and innovators who are really working on improving the financial health of their customers, employees, and communities. And we spend a lot of time thinking about the intersections between financial health and physical health and mental health. We're going to talk a little bit about that today, but we're also really here to talk about why the business community should care about this. And we're living in a time right now where increasingly CEOs and the business community is being looked to take stands and to engage on a whole host of issues, certainly issues that may go beyond the four walls of their business. At the same time, really since the financial crisis and the Great Recession, we've started to see a backlash against the Milton Friedman view of capitalism, in which really the only group that matters to you are your shareholders. We're seeing a return to a greater focus on the importance of your customers, your employees, and your communities, frankly, because it's the right thing to do and because it's a good thing to do for business. That's actually what's going to make your shareholders happy. And when you start to think about it from that perspective, you immediately find yourself focused on issues both of financial health and of physical health. They account for such a significant part of our GDP, and they account for such a significant part of the mind share of people in this country. So today I'm joined by three corporate executives to talk about all of these intersections and why helping to improve the health of their customers, employees, and communities is really the best way to deliver positive results to their shareholders. I'm joined to my left by Don Felix, who's the General Manager of Financial Health at JPMorgan Chase. Next to him is Jamie Kalamarides, President of Group Insurance at Prudential Financial. And next to him is Dave Anderson. He's the President and CEO of Health Now New York, part of the Blue Cross Blue Shield family. So help me welcome our panelists. So I want to organize the discussion today around the three stakeholder groups that I mentioned, customers, employees, and communities. And to start, I want to start with Don. You've got a customer base of about 24,000 households around the country. And you're also part of a company that, through the JPMorgan Chase Institute, is slicing and dicing its data in ways that provide incredible insights into the real financial lives of your customers. What are you seeing in terms of how physical and mental health issues are impacting your customers' financial lives, really, frankly, their bank accounts, and vice versa? And what are you doing about it?
So thank you very much, Jennifer. It's great to be up here with you. Jennifer is a significant partner to us in everything that we're doing. It's super important that we create a universal language around financial health and the approach to it. And I give a lot of credit to Jennifer and her organization for helping us in that development. So thank you, Jennifer. And thank you guys for being here today. For JPMorgan Chase, it is for us both a business imperative and a moral imperative. It is how we lead day in and day out. As part of the consumer bank, where we have 50,000 employees and 24 million customers around the nation, 5,000 branches, we are in every community.
I said 24,000. I knew that didn't sound right. 24 million, forgive me. Thank you.
Yes. So we are in every community, right? We serve every walk of life. We serve across the entire income spectrum, and we are they. Right? We are our customers. Mm-hmm. And so when you have the benefit of having millions of customers and tens of thousands of employees, they tell us, we see it, it's very easy to understand what we need to do. And so our mission is, how do we help our customers make the most of their money so they can make the most of their lives? And I pick up on particularly the second part of that. So again, helping our customers make the most of their money so they can make the most of their lives. And we know, like physical health, your financial health is essential to living a full and well-balanced life. And for us, it is largely around helping people with day-to-day management of their finances, the resiliency to withstand shocks to the system, because they happen all the time to all of us, and to help them with the long-term planning to help them reach their financial goals. And it is literally just that simple. And so, understanding that and, trying to deliver on that becomes super easy. As you will see, if you go into any one of our branches, we start with a very simple question. What are you saving for? And we have that conversation around what are they saving for, and we try to help them with understanding the path from where they are today and how do they get to a better place. Meaning, so your financial health is largely around those three things I mentioned, and it is can we understand your goals? Can we understand what your needs are? And then can we help you with the next best action? And it's just that simple for us.
Now, 24 million households in the consumer bank, they're not all the same.
No.
So talk to us about how you segment those customers, how you think differently about their different needs, and what kind of disparities do you see?
So, the interesting thing actually is across the customer spectrum, unbanked, underbanked, the masses, and the emerging affluent, the challenges are actually very much the same, right? And it's what I was just mentioning. People need help understanding, how to get started. It's usually just as simple as, how do I get started? Like, I have challenges managing my day-to-day bills. I have stress that comes as a result of that. I don't have enough in savings, right, to withstand, and I'm sure many of you know, and if you don't, 45% of Americans could not withstand a $400 shock to the system, whether that is something related to their home, their auto, or obviously healthcare. And what we're trying to do across the spectrum is, like I mentioned, helping them with the goals and helping them to understand what their options are, and then helping them with the actions. But then particularly for those who are unbanked and underbanked, it's how do we get you into the system, right? It is what is the services and opportunities that we can provide to get you in, right? And so recently we launched a new, and it's not about products, even though I'm about to mention the product, it's not about products, it's about people. And it's understanding where they are. And we understand that if you're living in a cash transaction basis, then you're not fully participating in the financial system. And if you're not fully participating in the financial system, you are still incurring stress, right? And that stress translates to your physical and mental well-being. And if I actually make it personal, like so for me, I am the first American in my family. I'm first generation American. And we a lot of times didn't know where our next dollar was going to come from. Well, my dad was a taxi driver. My mom did different jobs until we finally had some measure of stability. And you realize how expensive it is to live in a cash-only transaction-based system. And bringing people in through whether it's products or services that we can provide, whether it's secure banking, which we recently launched, or it's a new tool like AutoSave, which helps people to save. These are the measures that we're trying to employ to help people get into the system, but then across the spectrum, the challenges are the same, and it's what are those conversations that we can have, what are the tools that we can provide to help people to live a better financial life.
Got it. Dave, let me bring you into the conversation. We heard Don talk a little bit about folks who are already customers and who may be financially challenged, but also non-customers, folks who don't have access. And that feels to me a little bit like the conversation that you and I were having around the un and underserved. I wonder if you might talk a little bit about the connection between physical and financial health from your vantage point as the largest insurer in the western half of New York.
Yeah, sure. So first of all, thanks for having me. It's my first visit to the Institute. So I'm looking forward to other sessions as well. Appreciate being here. There is very definitely a connection between financial and physical health. And one of the benefits of being in the Blues organizations are sometimes the size is a little staggering, is that we insure collectively 1 in every 3 Americans. We have the largest database, healthcare database in the world. And what we're able to do is to look at that data and determine, based on segments of the population, what's effective for them, where the needs are, and where we need access, additional access, and even where quality measures are. And specifically to the question around the uninsured and the underinsured, there's a reach out to that population. Specifically, if a community is to grow and is to prosper. To give you just some context, our offices are in Buffalo, New York. 40% of the people in East Buffalo, it's a sizable urban environment. 40% of the people in East Buffalo are either at or below the poverty line. 20% of those people are chronically underemployed. And most of the time of which, when you hear about health plans doing wellness programs or reaching out to clients, it's those that have access. It's those that are in an employer-based system. It's those that have a primary care physician and that they are members of the health plan. The reality for the community to grow and to prosper, those that are not in that circumstance, that come in and out of Medicaid, that perhaps do not have access to a primary care physician in their immediate community, those have to be dealt with as well. And in many cities around the country, much like Buffalo, Cleveland, Detroit, you could go down the list, have populations, significant populations like that. And if we don't have a community view, if we say that is somebody else's issue, we're going to allow the government or we're going to allow public agencies to take care of those issues while we want to ensure the corporate employer marketplace, because that's where the money is. If that's our view, then that community will not prosper. And when I got to my plan, one of the first things my board told me, to their credit, was, you're going to invest in parks. You're going to build an ice rink downtown. You're going to help redevelop the waterfront. You're going to help create primary care facilities in what we call care deserts, where there are no primary care facilities, because that ultimately is what will allow the community to grow, and we grow only if the community grows.
So I love that connection between consumer and community, and if I'm hearing you correctly, it's a distinction without a difference. They are symbiotic with each other.
They're absolutely symbiotic.
And I completely take your point about it can't just be about the employers, but employers are a big part of the equation and their workforce. And so with that, I want to turn to Jamie, who is primarily focused on the workforce as a channel. And you're, through Prudential, providing a range of benefits and tools to workers. And that's been changing over the course of time. And Prudential in particular has been very focused on a broader frame of financial wellness and the linkage between that and physical and mental wellness. Tell me how that's playing out in your world.
Yeah, thanks, Jen. I too want to assert that financial wellness is so inextricably tied to overall wellness and mental health, and that it is our duty as both employers, but also as financial services providers, healthcare providers, to deliver outcomes that are improving the financial health of individuals and communities. And so how do we think about doing it? We think about it at Prudential in a similar way as Don said, the objective measures of making sure that people don't run out of money today, tomorrow, against unexpected shocks, and in the future. But we also think about the subjective element, and that is, how do I feel about my money? Am I stressed about it? And we have found that when you look at both the subjective and objective, that over a quarter of individuals in America don't have a correct match between how they feel and their reality. That 13% are too pessimistic. That is, they actually are financially strong, but they're stressed about it anyway. 12% of individuals are too optimistic. They think that they're financially strong, but they're not. Their foundation is built on sand. And that's matched with another 37% of individuals who are actually not financially strong and know it. And so the challenge is how do we create behavior change and then scale it up in a sustainable way? And we find the best way to do that is through the workplace. We can co-opt employers to provide scale to change behaviors. And why in the world do employers want to do that? Well, we're also employers up here as well. We want to do that because when employees bring stress to work, they're unproductive, they're more absent, they go out on disability more. We have a less productive workforce. We have a less engaged workforce. We have a less loyal workforce. And because of that, that increases costs. So even if we're not altruistic, which all three of us are as both employers and providers, even if you're not that, we can convince employers to get into this game to improve the financial wellness of their employees and of their communities to get a better outcome, back to Milton Friedman's point, to the shareholder. And I think that the challenge is how do we do that in a way that is scalable and easy and efficient, and that we use some of the defaults that we've learned around consumer behavior.
So talk a little bit about what you're doing for your own employees. I like to call it putting your own oxygen mask on first, particularly when you're a financial services company. What are you doing for the financial health of your workers? I could say the same thing for a health company. What are you doing for the health of your employees? Talk a little bit about that.
So Prudential, we want to eat our own cooking, right? If we're not applying these lessons and behaviors to our own employees, why in the world should any further employer or any consumer out there trust us? And what we found is when we apply this work to our own employees, we can get definite better outcomes. We've reduced short-term disability due to stress from 3 weeks. We've reduced a week off of a 3-week short-term disability for people who are stressed. We have reduced financial stress overall from 38% down to 14% by applying both counseling, behaviors, and solutions to those individuals. And the solutions cover the wide range of solutions, everything from emergency savings to student loan management to short-term and long-term disability to better savings for retirement. And if we cover all three of those elements, we think that that improves the overall financial wellness of individuals. But one other piece what we've done is we've just released some research where we've surveyed 2,000 people across America, and we have found that there is an absolute correlation between reducing financial wellness stress and financial wellness programs at the workplace. Interestingly, we're finding that these financial wellness programs, the things I just talked about that Prudential is doing for its own employees, are really only occurring for the most part at large employers, those that have 5,000 employees and more, and in the West Coast. And we find that employers are not using the same sort of incentives that they do around health wellness. So there are definitely lessons to be learned about that employees are looking for and demanding from their employers who they trust, an efficient method, an effective method, and where there's a consumer protection framework to start adopting some of these programs.
Yeah. So I'm glad you raised the small business point. And Dave and Don, I think you both have some experience and perspective on how do we think about small business as we talk about this conversation. What are you seeing, Dave, and how do you think about that?
Well, to Jamie's point, we insure 80% of the Fortune 500 companies. And those are large enough employers where wellness and programs and population health management can be done just for them because they are large enough to have a population where those metrics will work. And in fact, it's probably the most effective process you can do because it's a captive population and you can do measurements of that population year over year to see if what you're doing is having the intended effect and what you can do. So that's a significant effort on the larger employers. On smaller groups, if you have a group of 10 employees, for example, you really can't do that. That's not a large enough population. So one of the benefits of the health plan and the data that we have is that we can aggregate small group employers together across a community population and basically bring the benefits that IBM receives and Prudential receives and Chase receives to that smaller group population and administer that on on a collective aggregated basis so that we can look at that population as in total and be able to move the needle on health.
Can I just build on that just a second? In the retirement space, so 55 million individuals don't have access to retirement, and they're concentrated in small business, and they're predominantly women and people of color at small business as well. So there is policy changes that can make a difference on this. The Secure Act has passed the House 417-3, and it's now in the Senate. It allows small businesses to pool their purchasing power around retirement plans in the exact same sort of way.
Right.
Interesting. Don?
Yeah, for us, what we're seeing is obviously a lot of the jobs come out of small businesses, right? And increasingly, the costs are just getting higher. And so, the challenges, particularly if you think about non-employer small businesses who make up a large portion of small business owners, they're facing the same challenges, as I mentioned, that we're seeing across the entire spectrum, right? It is access to information, understanding how to manage increasing costs, and ways to get started. So some of the things that we're doing is across our branch network is we're hosting Chase Chats, right? And we're inviting small business owners in, and we're having conversations. And we're working through our local management to say, what are the questions that are on your small business owners' minds? And let's put together curriculums that will help inform and help guide. But what we also know is that curriculums by themselves are not enough. So then what's the action that then follows, right? And so what are the, again, it goes back to, and that's really our opportunity, is the fact that we are such a large institution. Can we create the right products and services that will help them with that next best action that they can take to improve their situation, whatever that may be?
Mm-hmm. So if we're going to have a conversation about employment, we have to have a conversation about the changing face of employment and of work and of the gig economy and robots, and are they going to take over the world? I don't believe they are, but they are certainly going to change things. And as it relates to this conversation, we've been talking about work, the employer, as a great place to scale programs and opportunities. But when an increasing share of people don't actually work at a company, or they're not employees of that company, or they have multiple jobs, how is that going to change this conversation we've just been having about how we make sure that people's financial and physical health matters are being looked after, and they're being able to take advantage of the kinds of things that traditional workers have been able to for decades?
So one of the things that it's interesting, right? Because sometimes you just have to keep it really simple. And particularly if you're in the gig economy, or if your income is somewhat volatile, even if you're stable, you're not working at a large company, I think sometimes we forget to help people understand, and this is I borrow again from my own personal experiences, it's not how much you make, but it's how much you keep, right? And it's helping them balance, what is coming in and to make smart decisions day to day. And that is where also there is a strong correlation to your financial health and your physical health, because quite honestly, from your physical health perspective, many of us are making day-to-day decisions, and it's about a certain kind of discipline and a certain kind of thinking, which then creates new behaviors and new habits. So if I'm trying to live, better, if I'm trying to have better physical health, maybe it's about a day-to-day decision about what I'm eating, right? Which similarly, in terms of if you're an essential worker, if you're like my mom who was a nurse's aide, or my dad who was a taxi driver, or if you're a teacher or a fireman or a policeman, your wages are probably set. Or if you're in this gig economy, maybe they're not set. So how can we help you make better day-to-day decisions about the income that you have, right? And then how do we help you also establish, and Jamie mentioned it, that sufficient savings to help you get through tough times. And I think people just don't think about that enough. And we're trying to take the opportunity, like I said, to help people think about those things, to say, how can you plan better for the future? How can we make sure that for whatever your circumstances are, you've got sufficient savings to get you through whatever that immediate challenge might be, whether it's health related or, like I mentioned, auto or home, because these things happen, they're unexpected, they're emergencies, or because you know that you're a gig worker, how do we make sure you start saving, which I know it can be hard. So we start slow, we start small, but at least we start, and then ultimately build that cushion that gets you over a hump if needed, where most people don't have 3 to 6 months of savings. So it's about establishing that mentality, helping people with those day-to-day decisions, but then giving them the tools so they can actually get there. And just one more thing, because I want to make it real in terms of the tool, and I had mentioned this thing that we launched called AutoSave. What I love about it is a little bit of a set it and forget it. It's an opportunity to say, you know what, whether it's periodic or payday, I'm going to establish putting some money aside, right? And we make it automated, we make it easy. And then you can just watch that balance grow. And so that's why it's important to, one, couple the conversation in terms of what do you need to do and why do you need to do it, with any action that helps and facilitates you to get there.
Just building on that, we know that about 15% of the individuals in America are participating in gig work right now, and the number's growing. And if you look at it, gig workers fall into two buckets: those that are doing a side gig on top of full-time employment, or those that are doing gig-only work. Those that are doing a side gig generally have access to employer-based benefits and can benefit from the scale of the things that we've been talking about. But those that are doing gig-only work experience the volatility of income and might not be able to match their expenses to their income, as Don has talked about. So they need solutions that are very different. And what we found is that the first thing that most gig workers need is actually planning to save for FICA taxes and income tax. And they also need solutions to be able to get access to things they normally couldn't get through. Sometimes they can get access through a partner or a spouse to employer benefits, but how do they get access to life and disability and other sort of group benefits where there's scale, efficiency, effectiveness, and consumer protections? What we're finding is that there's a growth of associations. The Independent Professionals and Self-Employed Association, IPSE, is a new organization specifically built for gig workers. And they're going out and advocating on gig workers' behalfs around public policy, but they're also providing group benefits to those gig workers and being able to take some of the lessons learned from the employer side and giving it to a scaled up solution so that we can not only do the behaviors that are important at the individual level, as Don described, but also bring some of the benefits of the workplace too.
So Dave, are we going to see more portability in benefits, do you imagine?
Well, I think that there's essentially the mechanisms for portability now. I think what the administration of portability is difficult, and that's an area we have to concentrate on. And it's related to what Don said. I wanted to piggyback on something that Don said, is that it is staggering to think that the average individual, or 85% of the individuals in the country, a $400 unplanned event would cause financial distress or worse. The average deductible of a health plan that is purchased from us is higher than $400. The reality is when an individual, whether they're through an employer or they come directly to the health plan and have a conversation about what they need and what they want to buy, it is generally a premium conversation instead of what is your financial situation. It's not a financial discussion about, because an insurance policy is a financial financing vehicle. It's a healthcare financing vehicle. And so I think this is a good example where collaboration and connectivity between financial health and physical health and even the community health for those that are not even able to purchase a policy at all. That's the importance of those connectivities, of those processes. And I think to the portability issue, I think that there's an overlap there as well.
Yeah.
When someone leaves our company because they're leaving their employer and they're going to a different environment and they're having now to purchase their coverage, they're not immediately connected to Don, for example, to say, all right, what kind of a conversation should they have at that point? Because it's a very different conversation they had when they were an employer group and the employer was subsidizing their coverage. So I think that there's work to be done in that connectivity.
Right. And one of the things that I often think about or talk about is this idea of who should be the central hub in people's health, I'll call it health lives, whether that's physical or financial. For a long time, it's been the employer. For some people, it's their financial institution. For other people, it may be their faith community or an association. The technology world would have you believe that maybe it should be them. And I think that in many ways, what we're seeing is sort of the race to figure out who's going to play that central role. And I think there's a business and competitive dynamic going on about that. But then there's also what's actually going to be the best answer for the consumer, for the person.
I think that building on both of these comments, it's how do we get individuals to sacrifice today for something that they might need in the future? And my son, a neuroscientist, tells me that we don't think about our future selves in the same way that we think about our present selves. We think about them in the same way as we think about a stranger. So if we can start, whether or not through community relationships or through technology or through the employer, starting to help people envision themselves in the future and the gap between where they are and where they want to be, we can get and motivate purpose. And if we can get people to think about purpose and that future and their legacy, then we see behavior change coming along. An example of this is disability income insurance. When people are injured and hurt and disabled, hopefully they have access to health insurance to pay the health and medical bills. But if they're not working, how do they have access for money to pay the rest of their bills, their housing, their transportation, their food, maybe their kids' education? We find this is the most underappreciated and underutilized benefit that there is and people have access to. Half of the people working in the United States don't have access to short and long-term disability income insurance. And of those that have access, only half take it. So how do we grow access to short and long-term disability? How do we grow access to paid family leave so that when people have emergencies in their family, they can continue to work and be productive or return to work once they get through this challenge? And a quarter of short-term disability and paid family leave is pregnancy related. So we are essentially, some employers who are not enlightened are firing people who are pregnant because they're not present, instead of thinking about all the investment that they've made in that employee and that employee wants to return to work.
So much of what I'm sharing is around the actions that we're taking. And we try to make this especially when I mentioned that we are they, and that so many of our employees represent our customers. And as I mentioned, it cuts across the entire income spectrum, race, gender, et cetera. And we try to lead by example. So for our entry-level branch employees, in most places, they're earning more than the minimum wage. At minimum, everyone's earning $15 to $18 an hour, and they're getting access to full benefits, right? And so I'm sure many of you probably saw, so we made a huge commitment, $125 million investment through our corporate responsibility arm for fintech solutions and financial coaching in communities. So we signal to our employees that we care about them and through the actions that we're taking. And then we also provide financial health education and opportunities to them directly. So a lot of what I've been doing these last few months in my new role is rolling out training that's helping people to understand some of the very fundamental things that we're talking about in terms of day-to-day management and resiliency, which then does translate to how we can help our customers at large, which I think is probably one of the more important things we can do when you talk about scale, and starting with our employees and then trying to take that to the general population.
Mm-hmm. I want to make sure we return back to the theme of communities. And Dave has particular passion on this topic. He's the head of a $3.2 billion company, provides health insurance to half of New York State. And as a result, he has a particular focus on place, as do the Blues generally. And I wonder if you could talk to us about that connection to community. You started talking about it before. And tell us more. You gave us some examples of what your board wanted you to do, but you've done some incredible things in community, particularly around not just about making sure there's access, but around preventative stuff.
Well, it's in our DNA. And I just as a point of context, you may not be aware that of all the blues plants across the country, so I'm not just speaking for myself, my own plan. I think what I'm going to express about some of the things we've done is a culture that exists everywhere throughout the blues system, is that all but one of those blues plans are nonprofit. And what that means is we don't have shareholders. We don't answer to stockholders, shareholders, or outside owners. Our view is that our stakeholders, which are our members, our patients, our doctors, our medical facilities, and our community, our employees and our communities, are our shareholders. And if you read the mission statement of a blues plan in whatever region you're from, and it's published, so I would go to their website and look it up. What you'll generally see is a discussion around patients, around employees, around communities, not about shareholders, because they don't exist for us. And so once that becomes a part of your DNA, it guides your passion about what you do. I'm proud to say that I'm up here representing an organization that last year invested $300 million in their communities on top of their normal business operations. And some examples of which we have done in our region, as I've mentioned, we've built parks, we built skating. We're in Buffalo, so you have to know how to skate in Buffalo. We've helped to redevelop and sponsor an entire waterfront development that was brownfield sites, it was contaminated sites, which was blighted for 70 years. Today, there's 1 million visitors a year on that site. For the community aspect of it, we not only want our members to go, and I'll be honest, for the various services like the skates that you rent and the Zumba classes that you might attend, we give our members a little bit of a discount, just because they're blue. But it's open to the entire community. They're not just for our patients and our members. It's open for the entire community. Because for us, our belief is with our community mission, not only is it the right thing to do, but all of those members are probably going to be all of those parts of the community, they're probably going to be our members at some point as well. And we want to have that, have been able to serve them from a community standard even before they came in their door. And
just say a little bit more about make the connection to wellness. So it's one thing that you want them to have a good feeling about you if they may become your customer, but right. I suspect that this is also makes it more likely they may be slightly healthier when they become your customer.
Well, that's it, Joe. I mean, if we wanted them just to like us, we'd give them all ice cream, I guess, or something, put up ice cream stands. But we have a very specific mission around our community contributions and a set of criteria that it goes through, and it has to relate specifically to health and wellness. That's why I mentioned parks. We build playgrounds for children. The skating rink, Zumba class. I mean, those are real things that we actually do. And the intent of that is to create, activities around wellness in the community. It followed a study that we did with the Ralph C. Wilson Foundation that the Aspen Institute actually helped us with that found that for children in our community under 15 years old, only 30% of them had an hour of physical activity a day. Where our express goal after that report was to raise that to 50% in 5 years.
Mm. So before I open it up to audience questions, get ready. I would be remiss if I didn't give Jamie a chance to talk about Pru's commitment to the community of Newark.
Yeah, since our founding in 1875, we've been headquartered in Newark, and Newark has gone from America's downtown and city to having real challenges. Some of the challenges of Newark, there has not been a new single-family home built in Newark for the last 50 years. There has 60% of Newark residents do not have enough savings to be able to last 3 months at the poverty level if they're without work. So Prudential has committed $1 billion to invest in Newark. And we've got 3 principles. We want to live local, we want to buy local, we want to play local. And so we've invested in the New Jersey Performing Arts Center. We've redeveloped an area for teachers to have affordable housing. We've put in place strategic investments throughout Newark so that we're creating pathways for people to be able to walk, experience, and live that reconnect the downtown to the Rutgers downtown university area. And because of that, Newark is starting to thrive again. We've put in place affordable housing through investments. We've coordinated and invested in urban farming. And we're getting other companies to come back into Newark. Mars and Company is coming back to Newark. Audible and Company is coming into Newark. And we're seeing a thriving of this urban center. There is more work to do. It is incumbent upon employers and other large institutions to reinvest back in their communities. You've heard examples of all of us doing that. And the reason why it's important is because unless our communities are strong and thriving, we're not fixing the social determinants that impact everything else around wellness and financial wellness.
Great. Well, on that note, I'm going to turn it over to you. I already have a question. Excellent. If you could stand up and just identify yourself.
Hello, Eli Hesterman's the name. I'm hearing a little bit of a tension here. There's a tone of benevolent paternalism, I think, as far as helping people. We know how to help you meet your goals. At the same time that you're trying to establish a relationship and build trust, which requires you to listen to whether it's your employees, your customers, your communities need. How do you strike that balance between we know what you need and we need you to tell us what you need?
I would say for us, and it's part of what I had mentioned, it is truly that we are they, right? We are our customers. We live in the neighborhoods, right? We have the day in the life. And when you understand the high cost of going to a check casher versus having a banking relationship, and when we also understand that there have been historically challenges around trust, which is why I talk about establishing a conversation and helping people, and starting with our own, we start with ourselves and we say, it's on our name tags. What are you saving for? Let me tell you what I'm saving for. I'm saving for my children's future. I'm saving also to buy a home. And when you can start to have just that conversation, you will find, and I would ask all of you to go and pressure test me on this. You will find that you can have a conversation with our bankers and our advisors that's not going to be about product. It's going to be about you as people, because we live in the community, right? Because we understand the challenges. And you're absolutely right. We cannot take a paternalistic view. We have to understand that many people are working 2 jobs and they have limited time, and we want to make it about convenience. We want to understand that cost of transactions and make it much simpler for them by, like I mentioned, some of the products that will make it much easier for them to be part of the banking community. 8 million people are unbanked. 24 million people are underbanked. So how can we help? How can we help with that? How can we help with the choices? How can we help and understand, because we live in the community, and I talk about myself coming from Brooklyn, where when you're trying to get, my mom worked 2 jobs, and you're going between 2 jobs, and the choices are, in terms of food, are poor. Right? Because we understand that, and because we can engage in the right kind of conversation, I think that's where it becomes less paternalistic, certainly non-judgy and non-intrusive, to help people, and they understand that we are actually trying to help.
If you have something burning, go.
Yeah, real quick.
We have a bunch of questions.
I think the tension is we're describing the challenges in the aggregate. You have to deploy solutions at the individual level. And there are some things, though, that we can frame by just changing the question. Do you want to opt out of your 401k plan as opposed to opting in?
So here's what we're going to do. Lots of questions and interests, which I love. Not enough time, but I would like to hear all the questions. I think there's a lot of learning just from that. And then these folks I know will make themselves available after. So let's just do a quick round robin of the questions. We'll see as many as we can get. And then we'll be able to give folks time afterwards to answer.
Hi, my name is Jennifer Dumond. So you all represent large companies with huge amounts of data on your employees and the individual customers that you serve. And from that, you're able to learn a lot about the needs of those defined groups and build new programs for them specifically. I'm wondering, are you looking at the unmet needs of the people you don't serve yet, or helping your business customers to do the same in order to expand the diversity of those groups you do directly serve and build the community health in general? From what you've all said, I think the answer is yes. So then really my question is, how do you look at that and how do you make decisions about what else needs to be done?
Great question. I'm just going to follow the microphone, so keep your hand up. There's one right next to you.
Yeah, great panel and amazing to hear about all the opportunity potentially. I'm wondering, Donald, if you could say anything about lessons learned from the work at JP Morgan, Amazon, Berkshire Hathaway. Like, what are some of the early best practices with Maven? And also, I'm curious, how many CEOs do you think that are here speaking at Aspen Health would really agree and has as much education on all of these opportunities as all of you four luminaries?
Great. There's a question right in front of you.
Hi, Dave Prakash. Mental health is second leading cause of disability and a huge impact on our economy in terms of absenteeism and presenteeism, but it's carved out of a lot of health plans. And so as employers, how do you look at trying to improve the mental health well-being as a way to improve your bottom line?
Excellent. Right here.
Hello, I'm Lisa Gill with Consumer Reports, and my question is, you've talked a lot today. By the way, this panel is amazing, and thank you for being here. You've talked a lot today about, saving for your future goals. My question is in regards specifically to the middle class. What about people that use debt or have had to use debt, either for student loans or medical loans or mortgages or even consumer debt to advance their goals? How do you help them manage debt? Debt to me is maybe one of the most important parts of this conversation. Thank you.
Okay, so I'm going to take one more question up front here, if she can get around quickly. And then I'm going to give each of you 30 seconds to close on whatever you just heard that you want to talk about.
Yep.
Earlier you asked about, who should be the hub?
Hold it closer.
Yeah.
Hold your
when the
microphone
person-
closer so we can hear you.
Okay, who should be the closer or the coordinator when the portability? Have you tried to involve trade unions as that hub?
Okay. Wow, that's loud. Okay, 30 seconds, each of you. Whatever you want to close on, ideally in response to something that was just asked.
Okay, I'm going to change that to close on because I only have 30 seconds, but I want to reference the question on behavioral health. I think that is absolutely right on. I will say, I'll go in front of my colleagues here and say that the health plans have missed it on behavioral health. Behavioral health is clearly emerging as an area that we have to relook as to how we service that particular aspect, because it is an umbrella event that is over all of healthcare, and unless you're in a plan that actually covers specifically behavioral health issues, and you're either underinsured or not insured at all, there's very little access to behavioral health, mental health services, and that's something that we need to invest in.
Jamie.
Debt is the BMI of financial wellness. And it is the fastest growing population with student loan debt is people in 50 to 60 years old co-signing for their kids. The solution place that I think around financial wellness is at the workplace. Employers have a business case to reduce stress, to reduce absenteeism, to increase loyalty, to increase engagement, and they've got the ability to put into scale solutions.
Don, you get the final word.
Healthy, performing employees, the cost benefits are easy. Performing versus non-performing customers, the value, if you need a business case, is easy. Taking it out of wonky terms, we try to keep it very simple. You will find that from the top down and the bottom up, that we're all speaking the same language when we're trying to help people. And it is borrowing, and I'll end where I actually started with Jennifer and the Financial Health Network and all the great work that's happening there. We just continuously tell our customers, those who we serve, those who potentially will come into the fold, Simple. And everyone can do this. Doesn't matter how much you make. Spend less, save more, borrow wisely, invest for the future. Let us be your accountability partner. Give us that chance to help you with that, right? Because that's what we want to do.
Excellent. Help me thank the panelists.
Thank you.